Spaces, is that something you had talked that orthodontics may be needed if it's too extreme, but how big a space can be fixed with veneers or eliminated with veneers?
I've done probably 2 millimeters, which is about a little over 1/8 of an inch. A fairly good space between the two front teeth, but it's very important when you do that to do a diagnostic wax up, because in the case I'm thinking about, we had to do 4 veneers, because if we'd have done only the 2 front ones, they'd look really, really out of proportion. Okay. So we can do 4 and reposition, make the 2 laterals or the ones next to the 2 front teeth a little bit bigger, and then we don't have to make the 2 front ones as big, and it looks in proportion. So yes, we do a lot of veneers to close spaces.
Okay, so it sounds to me like that it's not really a mechanical, it's more of an aesthetic with proportions that seem to have certain principles behind them, and that's kind of how you make sure the smile is optimized.
Da Vinci came up with what we call the golden proportion, and there's certain proportions that are more aesthetic, and we use those proportions. And a lot of people, you know, the mother, the father, you get genetics together. He may have 2 big teeth, and big teeth and little teeth, and you put them together, and sometimes they don't match up. So when we design a case, we design it by the golden proportion, and that always looks better.
So when we see these Hollywood stars and starlets with their obviously wonderful smiles, are those smiles typically the golden proportion so that they'll look the best?
Right.
Okay.